What is the primary mechanism of action of non-steroidal anti-inflammatory drugs? NSAIDs. A. Inhibition of cyclooxygenase enzymes. B. Blocking histamine receptors. C. Inhibition of leukotriene synthesis. D. Activation of opioid receptors. The correct answer is A. NSAIDs primarily exert their anti-inflammatory effects by inhibiting cyclooxygenase (COX) enzymes, which play a crucial role in the synthesis of prostaglandins involved in inflammation. Which of the following is a common side effect associated with the long-term use of NSAIDs? A. Weight gain. B. Gastrointestinal bleeding. C. Increased appetite. D. Hypotension. The correct answer is B. Long-term use of NSAIDs can lead to gastrointestinal bleeding due to their effects on the gastric mucosa, which can cause ulcers and erosions. Which NSAID is considered the safest option for patients with a history of cardiovascular disease? A. Ibuprofen. B. Naproxen. C. Aspirin. D. Diclofenac. The correct answer is C. Aspirin is often considered the safest NSAID for patients with cardiovascular disease as it has antiplatelet effects that can help reduce the risk of heart attacks. Which of the following NSAIDs is often used in the management of gout attacks? A. Indomethacin. B. Aspirin. C. Paracetamol. D. Celecoxib. The correct answer is A. Indomethacin is frequently prescribed for the acute treatment of gout due to its potent anti-inflammatory properties. Which enzyme is responsible for the conversion of arachidonic acid to prostaglandins? A. Lipoxygenase. B. Cyclooxygenase. C. Phospholipase. D. 5-LOX. The correct answer is B. Cyclooxygenase, COX. Enzymes convert arachidonic acid to prostaglandins, which are key mediators of inflammation. In which of the following conditions is the use of NSAIDs contraindicated? A. Rheumatoid arthritis. B. Chronic kidney disease. C. Osteoarthritis. D. Mild to moderate headache. The correct answer is B. NSAIDs can exacerbate renal function and are contraindicated in patients with chronic kidney disease due to the risk of further kidney impairment. Which of the following NSAIDs has the highest potential for gastrointestinal toxicity? A. Aspirin. B. Naproxen. C. Celecoxib. D. Ibuprofen. The correct answer is A. Aspirin is known to have a higher risk of gastrointestinal toxicity compared to other NSAIDs due to its irreversible inhibition of COX enzymes. Which of the following statements is true regarding the use of NSAIDs in children? A. All NSAIDs are contraindicated in children. B. Ibuprofen is safe for use in children over 6 months old. C. Aspirin is recommended for treating fevers in children. D. Naproxen is the first-line NSAID for pediatric patients. The correct answer is B. Ibuprofen is considered safe for children over 6 months old and is commonly used for pain and fever management in pediatric patients. Which of the following NSAIDs is an irreversible COX inhibitor? A. Ibuprofen. B. Aspirin. C. Celecoxib. D. Naproxen. The correct answer is B. Aspirin is an irreversible inhibitor of COX enzymes, meaning its effects last until new enzyme molecules are synthesized. Which NSAID is commonly used for the treatment of dysmenorrhea? A. Paracetamol. B. Aspirin. C. Naproxen. D. Acetaminophen. The correct answer is C. Naproxen is frequently used for the relief of menstrual pain, dysmenorrhea, due to its potent anti-inflammatory and analgesic properties. What is the effect of NSAIDs on platelet function? A. Increase platelet aggregation. B. Inhibit platelet aggregation. C. Have no effect on platelets. D. Only affect clotting factors. The correct answer is B. NSAIDs, particularly aspirin, inhibit platelet aggregation by blocking thromboxane synthesis, which is essential for platelet activation. Which NSAID is known for its potent analgesic effect and is often used in postoperative pain management? A. Aspirin. B. Ketorolac. C. Ibuprofen. D. Naproxen. The correct answer is B. Ketorolac is a potent NSAID that is frequently used in postoperative settings due to its strong analgesic properties. Which of the following NSAIDs is often used as a first-line treatment for osteoarthritis? A. Aspirin. B. Celecoxib. C. Acetaminophen. D. Paracetamol. The correct answer is B. Celecoxib, a COX-2 selective inhibitor, is commonly prescribed as a first-line treatment for osteoarthritis due to its efficacy and reduced gastrointestinal risk. What is the mechanism by which NSAIDs reduce fever? A. Inhibition of interleukin-6. B. Inhibition of cyclooxygenase in the hypothalamus. C. Enhancing vasodilation. D. Increasing metabolic rate. The correct answer is B. NSAIDs reduce fever by inhibiting cyclooxygenase in the hypothalamus, leading to decreased prostaglandin production, which lowers the set point for body temperature. Which NSAID should be avoided in patients with asthma due to the risk of bronchospasm? A. Ibuprofen. B. Aspirin. C. Naproxen. D. Diclofenac. The correct answer is B. Aspirin can provoke bronchospasm in asthmatic patients, a phenomenon known as aspirin-induced asthma, and should be avoided. Which of the following is a potential renal side effect of NSAIDs? A. Hypertension. B. Hypotension. C. Acute kidney injury. D. Chronic kidney disease. The correct answer is C. NSAIDs can cause acute kidney injury, especially in patients with pre-existing renal impairment, due to their effect on renal blood flow and prostaglandin synthesis. What role does pharmacogenomics play in NSAID therapy? A. Determines the appropriate dosage for all patients. B. Helps predict individual responses to NSAIDs. C. Identifies side effects for all medications. D. Has no role in NSAID therapy. The correct answer is B. Pharmacogenomics can help predict how individuals metabolize NSAIDs, which can guide treatment decisions and optimize efficacy while minimizing adverse effects. What is the significance of the term dual inhibition in the context of NSAIDs? A. Inhibition of both COX-1 and COX-2. B. Inhibition of two different signaling pathways. C. Inhibition of two types of prostaglandins. D. Inhibition of both pain and fever. The correct answer is A. Dual inhibition refers to NSAIDs that inhibit both COX-1 and COX-2 enzymes, which can provide broader anti-inflammatory effects but may also increase the risk of gastrointestinal side effects.